This is Janet, Hannah's mother.
This is Hannah, the patient.
This is Jake, Hannah's ex-husband.
This is Becky, Hannah's nurse.
This is Lauren.
Hi, I have a report for one of your patients. Are you ready?
Yeah.
Hannah Baker is a recently divorced 24-year-old female Catholic that presented with hyperglycemia and is a known non-compliant diabetic. Her A1C levels are elevated. She has had recent complaints of morning sickness, and she is 2 weeks late for her period. Her mother is highly involved in her care and is at her bedside often throughout her hospital stay. Her ex-husband is periodically by her bedside.
Yep.
Do you have any questions?
I do. Can you tell me what her most recent blood glucose was?
400.
Okay. And have we gotten any A1C results back?
11.
Okay, that is elevated. Okay, is she alert and oriented?
She is alert and oriented times 3.
Perfect. Is she having any issues with urinating or bowel issues?
She's had complaints of urinating frequently.
Okay, and is she taking any medications at home?
She has metformin at home but forgets to take it and has been craving a lot of sweets lately.
Okay, that's good to know. Okay, so it's Hannah Baker. She's a 24-year-old female, non-compliant diabetic, so she has elevated blood glucose of 400. Her last A1C was 11. She's 2 weeks late on her period. Mom is at bedside and ex-husband is sometimes at bedside, correct?
Yes.
She's Catholic and recently divorced. She has complaints of urinating frequently and she forgets to take her metformin at home.
That's correct.
Does she have any allergies that we need to be aware of?
No known allergies.
Okay, perfect. All right, thank you very much.
Thank you.
Hannah, Dr. Jacob would like to come in and speak with you. Is that okay?
Yeah.
Okay.
Hi, Hannah. Your tests indicate that you are pregnant.
What?
What are you thinking? You're recently divorced and now you're pregnant? Oh, I can't stand this right now.
Hannah? Are you okay?
This is just a lot of information to take in right now. My mom is right. I can't be having a baby right now.
She did seem upset as she walked out.
Yeah, I'm just trying to process all of this information. I don't know what to do.
Do you want to talk about your options? I can come back here in a little bit and give you some time to think about it.
Yeah, why don't you come back and give me some options?
Okay, we can do that. Hannah,
Yeah.
are you ready to discuss your options yet?
I don't think I want to do that right now.
Okay, are you ready to order some lunch?
Yeah, that sounds good. I've been thinking about peach cobbler all day.
Oh, I'm thinking you're probably going to need to order something that has a little more protein in it since we want you to have something that will not spike your blood sugar.
Yeah, what options do you have?
Maybe some things like steak that's high in protein.
Well, it's Friday and it's Lent and I'm Catholic, so I can't have meat on Fridays. What options do you have? Do you have fish?
We do have fish. Is
Yeah,
that what
I'd
you'd
like
like to order?
Yeah, I'd like some fish.
Okay, I'll get that ordered for you, okay?
Thank you. I really need to let my ex-husband know that I'm pregnant. Jake, I have something really important to tell you.
What is it?
I just found out that I'm pregnant.
Oh my goodness. Are you okay? Where are you? I'll be there as soon as I can.
Okay.
Hannah,
Yeah.
I have your food for you. It's time to get your insulin, okay?
Okay.
Okay. All right, let me get a few things scanned in, okay, before you start eating.
All right.
Okay. I need to scan your ID. And can you tell me your name
Hannah Baker,
and your birthday?
January 23rd, 1994.
Okay. It looks like you'll only be getting a couple of 2 units of Novolog.
Okay.
Okay. Hannah, do you know the risks that are associated with having diabetes and being pregnant?
I don't.
Okay. There's a couple of things that can make it a little bit complicated. One of them would be that you could have a pretty big baby, and the other one is if you don't manage your diabetes correctly, you could have spontaneous abortion.
Abortion? I don't believe in that. I'm Catholic.
Okay. Abortion does not mean that you are voluntarily doing it. It means that your body has done it for you, okay?
Oh, okay.
Okay, Hannah, I know that a pin is something that is new for you since you haven't really been on insulin yet, but what you have to do is you have to, first of all, know how much that you're giving. Second of all, before you put your needle on the top, you need to clean it. Once you put your needle on, you're going to turn it to 2 units and you're going to push that. That's called prepping your pin, okay?
Okay.
After you prep that, you need to clean your site that you're going to be using. After you clean it, you will go ahead, clean it, you will inject it. After you inject it, you need to hold it there for 10 seconds, okay?
Okay.
Once you've held it there for 10 seconds, you'll remove it, you'll get rid of the pin on top, and then you'll do the same thing next time. But I'm gonna need you to be able to show me that before you leave, okay?
Okay.
Okay.
Oh my gosh, are you okay?
Yeah, I'm just so glad you're here finally. They're telling me all of these things that I have to do. That I might have a spontaneous abortion. I might have this huge baby. I'm just so overwhelmed.
Okay, I'm here for you. I'll help remind you of things. We can get through this together.
Thank you.
Well, I have to get back to work, but call me if you need anything.
Okay.
I'm sorry I stormed out earlier. I was just upset with the news, but I'm here for you and my future grandchild, and so maybe we can figure it out together.
Okay.
Hannah,
Yeah.
I have some paperwork for you for discharge. Are you driving yourself home or do you have a ride?
I'm gonna take her home.
Okay. I have your insulin dose, but you need to give this to yourself before you can go, okay?
Okay.
Okay. We'll go over the paperwork in just a second. Let's get this medicine ready. Okay. Can you tell me your name
Hannah Baker,
and your birthday?
January 23rd, 1994.
Okay. Let's go ahead and check your blood sugar. I'm gonna poke your finger. Okay, and here's a cotton ball. Okay, it looks like your blood sugar is 160. It's a little high, so we'll go ahead and give you a couple units. You'll get 2 units of Novolog. Okay, so I'm going to have you prep this pen for me and show me how you would do it, okay?
Okay. So I turn it to 2, press the end to prep it, and I'm going to go ahead and clean my site. Push it in,
Hold it for how many seconds?
10 seconds.
Yes.
7, 8, 9, 10.
Okay.
Pull it out and remove the needle.
Okay, perfect. Good job. Okay. I have your discharge paperwork here for you. I'm gonna let you take a look at this. I'll explain everything to you, okay?
Okay.
So make sure that you're controlling your blood sugars, okay? If you don't, remember that that could cause you to have some other issues with your pregnancy, such as spontaneous abortion, or you could have a very big baby, which could cause further issues. Do you have any questions about your Novolog order that you have going home, or?
No.
Okay. Well, if you have any questions, you can call us, okay?
Okay.
All right, and here's the number for your endocrinologist right here, okay?
All right.
Okay.
Thank you.
You're welcome.
I finally come to realize the importance of managing my blood glucose levels, especially now that I'm pregnant.
I mean, it's really important actually, because if you're healthy, then the baby will turn out healthy.
Yeah. I don't want those bad things to happen to me. I'm more motivated now.
That's good. Hannah, are you sure you're ready to leave?
Yeah, I'm ready.
Do you have any questions for the doctor?
No, that nurse gave me a lot of information. I now know that it's important to monitor my diet, make sure I can monitor my blood glucose levels as well. And she gave me all of these helpful papers to help me monitor them.
I mean, but it's important that you know everything that you need to know, though. You have to make sure that you are actually ready to go.
Yeah.